for open session, and if we could have our legal counsel report on a closed session.
Is your microphone on?
Yes, thank you, Chair Wong. The board did consider 5 items in closed session this evening. The first 2, conference with labor negotiator and hearing under Health and Safety 32155, there was no reportable action. The third item, the closed session minutes, those were both approved on a 5-0 vote. There was no reportable action on the annual quality assurance performance improvement report, and the medical staff credentialing was also approved on a 5-0 vote. That concludes my report.
Thank you very much. Are there any deletions, corrections to our posted agenda? Is it on now? Okay. So are there any deletions, corrections to the posted agenda? Hearing none and seeing no one raising their hands, then we'll go on to input by our audience. And this is an opportunity for our public to make any kind of comment on something other than what is posted on our agenda. You have an opportunity to speak for 3 minutes. And again, if you would, please come to our lectern and give your name for the records. Again, we can't discuss anything that's presented since it has not been agendized, but you are able to speak for 3 minutes on your subject. So is there anybody that wants to do audience input? Do you want to step up to our lectern, please?
Okay. Hi, good evening. My name is Deirdre Henderson. You know me by now. I'm a patient at Tahoe Forest. I'm a Truckee resident, and I am the group leader of the North Tahoe Chapter and Citizens Climate Lobby. So last month when we attended your board meeting, there seemed to be an interest in Tahoe Forest joining the Climate Transformation Alliance in our community. And that apparently has not yet happened, but we just want to let you know that we would like to support your involvement in CTA in any way we can, because we think that you are an essential participant in achieving the community's climate pollution reduction goals. I'd like to mention to you that CTA has recently gotten a $500,000 grant to pilot a building decarbonization program, which involves workforce capacity building and public communication and a one-stop shop service to help building owners to navigate building electrification and access to qualified contractors. Another benefit that just came across my desk today that I want to mention to you because I think it's typical of the kinds of things that would benefit you as a member of CTA. There is a CTA member that's working on installing or wants to install an on-site food waste composting system, and it could be funded in its entirety by a Cal Recycle Organics grant. The problem for them is that the grant amounts are too large. So they are looking for 2 to 4 community co-participants, co-applicants for this grant. And you wouldn't have to be all in the same location, could be in different parts of the community. So they would frame the project as a community program. So this strikes me as something that the hospital might find of real interest. I also want to say that we track some of the medical community media, so of course we see the financial challenges facing all hospital systems. This was outlined very well by Mr. Weiss in his report to the board in your agenda packet. And we want to emphasize that the kinds of things that hospitals are doing, the kinds of decarbonization and sustainability measures that they're engaging in, are very often reducing, not increasing costs. So I hope that encourages you to consider that. Finally, we'd like to know if there is a member of your board who has a particular interest in environmental sustainability, with whom we can meet to explore some of the information and resources and contacts that we have to offer you in pursuing your environmental sustainability goals. So thank you very much.
Thank you so much for your comments. Again, the hospital is involved in our environmental stewardship. We have a plan of action that we're taking, and there is some discussion about joining with other members of our community in looking at how we best can utilize our resources and our manpower to improve, if not protect, our environment. So thank you again for your comment, and we can have it, the thoughts that you have about education brought back to our staff to see if anybody's interested in doing that. So thank you again. Do we have anybody from our Employees Association that wants to give input? Okay, seeing no one, then we'll move on to item 12, our Medical Staff Executive Committee's meeting consent agenda. We have Dr. Capel here today to present that.
Hi, good evening. I'm here to present the open agenda item regarding the policy changes for the Incline Village Community Hospital. And this change was specifically for just the addition of a risk statement to the policies. There was no content or procedural changes other than that. And the purpose of this was to align us with the idea of being a high reliability organization. And that is it.
Any questions from our board members regarding the Incline Village policies? No. But thank you so much for bringing it. I know that the High Reliability Committee put forth the direction to do risk statements, and I know that we've been working on those, so it's nice to hear that Incline has got theirs done. So thank you again. So now we need to have a approval of the Medical Executive Committee meeting consent agenda.
I will move to approve the Medical Executive Committee consent agenda as presented.
A second, please. Second. So it's been moved by Director Barnett, seconded by Director Brown, to approve the Medical Executive Committee meeting consent agenda. All in favor?
Aye.
All opposed? Then the consent agenda has been approved. Thank you so much for filling in for Dr. Koch while she's gone. Our next item on 13 is the consent calendar, and these are generally reports from our administrative staff, as well as possibly some other non-controversial report. So there is the opportunity for anybody from our board to pull a topic if they wish. So anybody want to pull us one of the items under the consent calendar? Any of our staff? Any comments from our audience? Okay, seeing none and hearing none, can I have approval of the consent calendar as presented?
Or I move to approve. I'll second.
Okay, so but it's been moved and seconded. It's been moved by Director McGarry and seconded by Director Shamlin to approve the consent calendar as presented. All in favor?
Aye.
All opposed? Okay, so the consent calendar has been approved. Item 14, and this is just for board discussion. We have the Patient and Family Advisory Council, and Janet and Dr. Kern, is it Alan Kern? One of the members of the PFAC committee will present.
Thank you, Chair Wong. I am Janet Van Gelder, the Director of Quality and Regulations. Alan Kern is a Patient and Family Advisory Council volunteer and a member of our foundation board. We're here to share the annual report, our Patient and Family Advisory Council Annual Summary Report for 2022. First off, I wanted to share this is our 9th year that the volunteers have actively been engaged in operational suggestions to improve health system processes in the experience of our patients and visitors. I really want to highlight the members because they volunteer their time, 9 meetings a year for an hour and a half to help our health system improve how we provide services. First is Doug Wright. He's an original member from 2015. He is currently an honorary member, which means he doesn't have to come every month. Ann Liston, Patty Johnson, Helen Shadowins, she's also an honorary member most recently, Kevin Ward, Sandy Horn, Violet Nakayama, Alan Kern, Bill Poland, Karina Toledo, and Chris Valerio. Want to really recognize our volunteers for the time and effort they spend to help our organization. And then, Alan, can you go over this?
Yes, good evening. I'm Alan Kern. I've served on the PFAC committee since 2020. And I just want to say that it's a privilege to serve on the committee. It's really a unique opportunity to provide feedback and comments to Tahoe Forest Health System from a patient perspective. And it's also a great opportunity to learn about the health system because we have many presentations from different departments, and we learn about new initiatives and new provider services that are available. I want to list a few of the, and review a few of the accomplishments and activities of the PFAC during 2022. In late 2021 and first part of 2022, the PFAC committee meetings were placed on hold because of the COVID-19 surge. But we started back up via Zoom in February of 2022. And during 2022, we added 3 new members. One member was a longtime second homeowner and lives approximately half the year in Truckee. And 2 other members are young mothers whose children were born at Tahoe Forest Hospital. So what better way to provide input to the hospital system? And both of the women are bilingual in English and Spanish. During the year, we send out an engagement survey to all PFAC members to provide their interest and their input on meeting structure and what was going well, thoughts, constructive comments on changes, meeting times. And I wanted to mention that we also some of the PFAC members participated in the Beta Heart survey in May of 2022. And I think there was a common thread between the comments from the PFAC members between the engagement survey and the Beta Heart survey. And that was a concern with access to care. And there were really 2 components of that concern. One was related to capacity issues as to whether the current provider staff was sufficient to provide services given the dramatic growth in the population in Truckee. And the second component was related to more of continuity issues because the PFAC members felt that it was very important that patients are able to see providers that have knowledge of their medical history and background. There were also changes to the PFAC charter that were reviewed and approved, including membership terms and clarification to the process of membership onboarding and recruiting.
Thank you, Alan. As Alan already mentioned, many of the PFAC members participated in our annual validation survey and were interviewed, as were some of our board members last May of 2022, and provided some great input and insight into areas of focus related to that beta survey. In addition, the types of topics that monthly we present, as Alan mentioned, we talked about and shared the overview of Beta Heart, the substance use program, the Level 3 Trauma Center, senior services study that one of our graduate students conducted under the case management director, clinics and access to care that he mentioned. We recently, stigma, bias, and cultural sensitivity, that's so important in healthcare. And our new service line with Dr. Ruggiero, the developmental and behavioral pediatrics. And when we met last week, we had, or this week, Cancer Center and the Infusion Center. So those are the types of topics that we talk about and ask for input from our volunteers. Some of the input for improvements they've recommended was patient scheduling and access, senior citizen services and resources, and how we can better address those complaints that we do receive from our patients and family members. As Alan mentioned, we did resume our in-person meetings in January. It's hybrid, so that those that choose, they're not ready or they're not locally in town for our meetings, they can participate via Zoom, and we're meeting in the Cancer Center conference room. So things that we are focused on as far as strategic planning, we always, again, based on the charter and the survey that we ask for our PFAC members just for input, is primary focus is, again, meeting times, providing updates to the PFAC members of new or key departments across the health system. Always appreciate feedback when we do receive patient complaints. We love to hear from our PFAC members, their insight on how we might manage that to avoid it happening again in the future. Always open to member recruitment and diversification so that the PFAC members represent our community. That's very important, and different ages, because, different perspectives are always a positive thing for us. And then we did have a PFAC member volunteer to speak at our next board quality meeting that we're having in June. And I know in the past, those of you that have participated in that, it's really beneficial for us, all of us, to hear the patient and family perspective of the care they received within the health system. So one of our PFAC members has volunteered to do that at our next meeting, which I believe is in June. So we're always looking for individuals, so if you know of somebody, please send them our way to quality, and whether they might be interested in volunteering or sharing their story, we would appreciate that, so let me know. And we really want to spend the time on answering any questions you have about PFAC and having Alan answer any questions. We did send the link to the video to the members, so I suspect many of our PFAC volunteers are watching this right now. We asked them to attend in that manner if they could. So, any questions that you may have?
Alan, I'd just like to say, excuse me, this is my 10th year on the board here. I have a perspective that's not shared commonly around the room here, because I go back to an era when there was a pretty serious disconnect between the hospital and the community, and I just want to thank you for your work to assist in bridging that gap. I think your service does a tremendous amount to rectify that situation that once existed.
Well, thank you. I think I could say on behalf of all the PFAC members that we want to do whatever's possible to support the Tahoe Forest Health System in any way we can.
And again, I think the whole board wants to reiterate what a value we have for the committee and the input. I think the one thing that I really appreciate about PFAC is it's our connection with the community, and it's one that understands what's going on within the health system and can say, here's the issue that we're hearing, because we'll hear selective issues, but if it comes from PFAC, it may be a group of you seeing a trend that we could know about. So thank you again for your years of service and the input you give to our health system.
Thank you.
Alan, this is Bob Barnett. I just, again, want to thank you and say that community health is an issue that the board has been quite interested in. We spent a lot of our retreat time looking at the issues, trying to make sure that we have identified out in the community what the healthcare needs are and the various cultures in different communities to try to understand how we can best serve their needs. So anytime you get information on that subject, we're very interested in that, and I think because you're more of a grassroots organization, there may be information you can supply us in that area that we'd be grateful for, so I just wanted to put that out to you.
And some of the programs, you know, the whole toolkit that you give every unit, that they can use to give recovery things to, for maybe a delay in service, has all made a difference in how our patients perceive us, in that they recognize that this isn't how it was supposed to go. So to make up for it, we'll give you this, and hopefully we can get you in quickly now. So thank you again for those programs.
Well, I think also from my perspective, it's the approach that Tahoe Forest Health System takes is very different and unique in the interest that you just described in hearing from the community and hearing from patients is something that I know all the PFAC members consider as really valuable, because they have a chance to provide input, and they feel that the Tahoe Forest Health System is interested in listening to their issues. And I don't think that's true in other health systems that I've been had contact with in the past. And so I think that's really something of value among many other things here at the Tahoe Forest that is terrific.
Yeah, if I may, I'd like to echo the sentiments that you've heard earlier from everyone, and how much we appreciate all that you do and all the other PFAC members. And once again, to follow on what Mr. Barnett was just saying, because we are involved in community health, we are not just interested in what happens, to get your feedback from not just what happens within the hospital walls, but anything that you can think of out there in the community that we can be doing to keep you from having to be here would be beneficial too. Any avenues for health screenings, anything like that you see where there's a void in the community, if you would think of us and let us know.
Absolutely. And I think also the information that we receive in the other direction from the hospital system, because many people and many of your colleagues take the time to spend with the PFAC members and during the PFAC meetings, and that information is really helpful for the PFAC members, because then they can be advocates for the health system in the community. They're able to talk to their colleagues and friends about what's going on with the health system, and I think that's a useful part of the PFAC committee meetings as well. So it's definitely a two-way
Any
street.
comments from our?
Yeah, one last one. Jen, it was great to see that there were 2 young moms that joined. Do you feel, and not knowing what the rest of the group looks like, do you feel it's representative of the community at large, or are there challenges in getting members that are diverse? Yeah.
There have been challenges. We've had more toward those that are retired. And so Alex has really worked hard to recruit younger, like 2 moms. We're so excited to have them join us. And
bilingual, even better. Yeah.
What?
And bilingual, even better. Yeah.
And to better represent, but we're always open. We have cards we're placed around all the clinics, just so that if somebody's sitting in the waiting room and they see it, it's talking about the PFAC, and if they're interested, to reach out to Alex from. So it could be more diverse, but we're getting there.
Yeah.
Great.
Okay. Any comments from our audience? I guess seeing none. You've covered it all for us, Alan. Thank you so much for your input. And please extend our gratefulness to the rest of the PFAC members on the work that they do.
Thank you very much for the opportunity to speak and share the evening with you.
Take care.
Okay, we'll move on to item 15, and this is the addendum to the Memorandum of Understanding, and we've got 2 memorandums to deal with today. We have our Chief Human Resource Officer, and I guess Lauren's not going to be part of it. Okay.
She went home for her baby. I'm not sure if you, sorry, I'm not sure if you want me to go over all the changes that we talked about earlier, or if I can just ask for your approval of the addendums as presented in the board packet.
Does anybody have any other questions that weren't covered by Alex previously regarding the memorandum?
I don't have any new,
Okay.
I don't have any new questions.
So just for everybody that's here, we have two memorandums, one for the Employees Association and the other one for the Employees Association Professional, and it's for those that are working in the multi-specialty clinics.
Correct. The multi-specialty clinic employees were not represented prior to these addendums, and this work that we've done over the past 6 months has been to incorporate those employees into the current MOUs that we have with the two separate union groups.
Okay.
Alice, I would just say that we were provided copies in advance so we could read them, and then we've had a review with Alex on all of the pertinent changes and items of interest. So I feel satisfied that I understand it and I'm prepared to go forward.
And the only other comment I'd like to make is I do really appreciate the team members that worked on this from the union side. It's always, tough conversations sometimes, but they did a lot of work. They put a lot of effort into it. And so for that, I really appreciate the employees that took part in the negotiations.
Well, we've heard, and we have copies of it, but I wonder, does the audience have any questions about either of the memorandums or why we're doing it? Okay. Then, can I have a motion? Can we do both of them together, or do you want us to do them separately?
I think we need to do them separately.
Okay. So can we have a motion to approve the addendum to the Memorandum of Understanding for the Employees Association as presented?
So moved.
Okay, a second, please.
I'll second. Michael?
Okay, so it's moved by Director Brown, seconded by Director McGarry, that we approve the addendum to the Memorandum of Understanding for the Employees Association of the Tahoe Forest Hospital District. I'd like to do a roll call vote on this.
Director Brown?
Yes.
Director Shamblin?
Yes.
Director Barnett?
Yes.
Director McGeary?
Yes.
Director Long?
Yes. And so then we have the Memorandum of Understanding for the Employees Association of Professionals that has an addendum. Can I have a motion for that memorandum?
So moved, Dale.
Okay, a second, please.
Director Barnett, I will second it.
Okay, so it's been moved by Director Shamblin, second by Director Barnett, that we approve the addendum to the Memorandum of Understanding for the Employees Association Professional of Tahoe Forest Hospital District. A roll call vote.
Director Brown?
Yes.
Director Shamblin?
Yes.
Director Barnett?
Yes.
Director McGeary?
Yes.
Director Long?
Yes. So both of those addendums have been approved by the board. Go forth and do your work. Thank you so much for your work.
Thanks, Alex.
Okay, we didn't have any consent calendar items pulled. Have we had any board committee meetings since we met in February?
I think we were retreating.
We did have a foundation meeting. If I can find my notes, yes. So the Hospital Foundation met, some updates just on the fundraising, about $700,000 raised to date, so we're doing really good compared to years past. The item that probably raised the most discussion was a request from the Neuro Department for some grant funding to start a program. I think we even covered some of this in our retreat. And the outcome of that was not approval of the grant, but a discussion that we need a better process so that we don't just get random requests for grants, considering there's likely ongoing expenses to maintain those programs, once the grant funding expired. So that was pushed to a further discussion on that. I think that's about it.
All right. There'll probably be several committee meetings happening very quickly because the board went to the AHA Rural Health Conference and got a lot of great ideas. Some of them that we're going to think about how to do it here at Tahoe Forest, how it's going to affect some of our committee work. And after that, we went to a retreat. We had a retreat to come up with our board goals, what we want to be accomplishing as a board at the end of the year. And so there's going to be a lot of work that we're going to have to be done, but it was a great learning experience, both the conference as well as our retreat, in terms of finding out new things that are happening, how we could better improve some of the work that we have to do. And then my last comment is on March 30th. It's Doctor's Day. So those of you in the audience who are doctors, we hope you have a great Doctor's Day, and we wish you the best. Any other comments? Any other closing comments?
Yeah, one thing, we're going to have a Finance Committee meeting in April. We normally review the Chandler Associates and also the current financials, but we're also going to take a look at the viability of our bank in respecting what's gone on with the banking world. For those of you who read the news, there are some issues. SBC obviously has had terrific troubles, but there apparently are other banks that could conceivably be in the same situation. And while we are protected to a greater extent than just FDIC, it still would be a tremendous disruption if our bank had some difficulties and our access to funds was not immediate. So we're going to take a look at that. Right, Crystal?
Okay. And if there aren't any further comments, then the meeting's adjourned. Nice work, guys.
Well, I was going to say.